The canine eye. In this lesson, we will look at the anatomy of the eye, common ocular health problems, and how the groomer can assist in maintaining ocular health in pets. The eye is a globe-shaped organ that provides the dog with sight, one of the 5 senses. The eyeball is located in a bony cavity in the skull called the orbit. The eyeball is cushioned within this socket by muscles, fat and connective tissues that help stabilize and protect it. Muscles attached to the eyeball enable its movement within the socket, allowing for adjustments in focus and orientation. Understanding the anatomy of a dog's eye can help in detecting potential issues early and taking proper care of your client's ocular health. The sclera is the white part of the eye and is a thick outer layer that serves to protect the internal structure of the eye and to maintain the eye's shape. It is densely made up of elastic fibers and collagen, which is a protein and is the most abundant protein in the dog's body. Dogs produce collagen on their own, but aging and exposure to toxins and UV rays affects production of collagen. The cornea is a transparent dome on the front of the eye that lets light in and helps focus light onto the retina. Its thickness increases with age. The conjunctiva is a thin membrane that covers and protects the outer surface of the eye. The iris is the coloured part of the eye and it controls the amount of light entering the eye by adjusting the size of the pupil. The pupil is the black circle in the centre of the iris and is an opening that allows light to enter the eye. The lens is a transparent structure that is located behind the iris and helps to focus light onto the retina. The lens is held in place by suspensory ligaments. The ciliary body is an extension of the iris and contains fluid and muscle fibers that control the thickness and shape of the lens to allow the lens to focus. The retina is a layer of sensitive tissue at the back of the eye that converts light into nerve signals. The optic nerve transmits visual information from the retina to the brain for processing. The vitreous humour is a clear gel-like substance that fills the space between the lens and the retina to help keep its shape, and it provides nutrients to the eye. The retinal blood vessels supply blood to the retina. The eye has an upper and lower eyelid, which contain muscles that enable movement of the eyeball. The eyelids are covered by a layer of skin on the outside and mucous membrane on the inside. The eyelids join at the medial canthus. Underneath the upper and lower eyelids lies the third eyelid, which serves to protect the eye and keep it moist by spreading tears. It is made of cartilage and muscle and covered with mucous membrane. Eyelashes grow from the outer edges of the eyelids and help protect the eye from foreign objects and excessive light. They also help to distribute tears. The lacrimal gland is found under the upper eyelid and continuously produces tears that flow over the front surface of the eyeball. The tears lubricate and moisten the eye, helping to cleanse and protect the eye's surface. The tears drain away into 2 small openings located in the medial canthus, which is the corner of the eye where the upper and lower eyelids meet. The 2 small openings that drain the tears lead into the nasolacrimal duct and into the nasal cavity. Lacrimal duct obstruction in dogs is when a blockage or partial blockage occurs in the ducts, preventing tears from properly draining, which results in the tears overflowing and running out of the corner of the eye, causing visible tear stains on the skin and fur below the eye. It usually occurs when airborne dust and debris accumulates in the nasolacrimal ducts and causes inflammation and/or infection. This may often remain an aesthetical problem, but in some dogs, if left, it can result in ocular discharge, redness, and sometimes even infection in the affected eye and in the skin below the eye. Lacrimal duct obstruction in dogs can stem from various other causes as well, both congenital, which means present at birth, and acquired, developed later in life. Some other common reasons include congenital abnormalities, which are anatomical abnormalities that dogs are born with, which affect the development or structure of the lacrimal ducts due to the shape of the skull or eye, which can result in conditions where the opening didn't develop. Breeds commonly affected include the American Cocker, Poodle, and Golden Retriever. Other abnormalities might include narrow ducts or abnormal openings. Trauma from head injuries or trauma around the eyes can damage the structures related to tear drainage and cause an obstruction. Conditions like conjunctivitis or other infections in the eye area can lead to inflammation and subsequent blockage of the lacrimal ducts. Benign tumours or malignant growths in or around the ducts can physically block the drainage pathway, leading to obstruction. Particles, debris or foreign objects can get lodged in the ducts, causing blockages. Inflammatory diseases such as chronic allergies or autoimmune conditions affecting the eye can cause swelling and blockage in the ducts. As dogs age, the tissues surrounding the ducts may change, leading to a higher risk of blockage. Heterochromia in dogs refers to a condition where a dog's eyes have different colours or variations in colour within the same eye due to the lack of melanin, which is the pigment that gives colour. This phenomenon can occur in various ways. Complete heterochromia is when each eye is a distinctly different colour. For instance, one eye might be brown while the other is blue or white. Sectoral or partial heterochromia occurs when there's a section or part of the eye that has a different colour. For example, a part of the iris might be a different colour from the rest. Hereditary heterochromia can be present in various breeds, including Siberian Huskies, Australian Shepherds, Dalmatians, Border Collies and Great Danes, amongst others. While it is often a genetic trait, it can also occur as a result from injury, trauma, or certain health conditions affecting the eyes. In many cases, heterochromia doesn't affect a dog's vision or health. However, it's essential for dog owners to monitor their pet's eye health and consult a veterinarian if there were any changes in the eye's appearance or if there are signs of discomfort or vision problems. Entropion is a condition seen in dogs where the eyelid, usually the lower one, rolls inward towards the eyeball. This inward rolling causes the hair on the surface of the eyelid to rub against the cornea, leading to irritation, discomfort and potential damage to the cornea. Some common signs of entropion in dogs include excessive blinking or squinting, excessive tearing, redness and irritation of the eye, pawing at the face, rubbing the face against surfaces to alleviate discomfort. Entropion can be congenital, which means present at birth, or acquired later in life due to scarring, inflammation, or changes in the eye or eyelid structure. Breeds with facial folds or loose facial skin, such as bulldogs, Shar-Peis, and bloodhounds, are more prone to this condition. In puppies, temporary sutures can be placed in the eyelid to roll the eyelid outwards. The puppy would be monitored up to around 4 or 5 months of age to see if the entropion resolved itself as the puppy grows. Treatment otherwise typically involves surgery to correct the eyelid's positioning. The surgery aims to reshape the eyelid to prevent the inward rolling and to alleviate the irritation on the cornea. If left untreated, entropion can cause chronic eye issues, including corneal ulcers, scarring, and impaired vision. If you suspect your dog might have an entropion, it's essential to consult a veterinarian properly. They can evaluate the severity of the condition and recommend appropriate treatment options. Ectropion is another eyelid condition in dogs, but in contrast to entropion, where the eyelid rolls inward, ectropion involves the eyelid rolling outwards or sagging away from the eye. This condition leads to exposure of the inner surface of the eyelid, causing potential irritation, dryness, and susceptibility to infections. Key features and signs of ectropion in dogs include outward rolling or drooping of the lower eyelid, excessive tearing, redness and irritation of the exposed part of the eye, potential development of secondary eye infections, and discomfort or rubbing of the eye area. Breeds with loose facial skin or droopy eyelids, such as bloodhounds, St. Bernards, and Basset hounds, are more predisposed to ectropion. Additionally, it can be congenital or acquired due to aging, scarring, or facial nerve paralysis. Treatment for ectropion depends on the severity of the condition. Mild cases may not require intervention, but severe cases often necessitate surgery to correct the eyelid's position. Surgical correction aims to tighten and reposition the eyelid to prevent the outward rolling and improve the eye's protection. Regular vet checkups are crucial to monitor and manage ectropion, especially in breeds prone to this condition. This helps prevent complications like chronic eye irritation, infections, and potential damage to the cornea. If you notice any signs of ectropion in your dog, it's advisable to seek veterinary advice promptly. Cherry eye in dogs refers to a condition where the gland of the third eyelid protrudes or becomes visible, resembling a small reddish-pink mass at the inner corner of the eye. This condition is formally known as prolapse of the gland of the third eyelid. The third eyelid has a gland responsible for tear production and distribution in the eye. When the ligaments holding this gland weaken or are affected, the gland can protrude, leading to cherry eye. Signs and characteristics of cherry eye in dogs include red or pink masses at the corner of the eye, swelling and irritation in the affected eye, excessive tearing or discharge, squinting or blinking more than usual, and rubbing or pawing at the eye. Cherry eye is more common in certain breeds, such as bulldogs, cocker spaniels, beagles, and Boston terriers, but it can occur in any breed. It can affect one or both eyes. Treatment options for cherry eye might include medication. Initially, vets might attempt to reduce inflammation and swelling with topical or oral medications. Surgical correction. If medications don't resolve the issue, surgical correction may be necessary. Surgery involves repositioning the gland back into its normal position and securing it to prevent reoccurrence. There are different surgical techniques used to address cherry eye, and the choice depends on the severity of the prolapse and the veterinarian's preference. It's essential to address cherry eye promptly to prevent complications such as dry eye or potential damage to the eye due to chronic irritation. Early intervention often leads to a better outcome and reduces the risk of complications associated with the condition. Consulting a vet is crucial if you notice any signs of cherry eye in your dog to determine the best course of action for treatment. Progressive retinal atrophy, PRA, in dogs refers to a group of genetic diseases affecting the retina. It's characterized by the degeneration of the photoreceptor cells in the retina, which are essential for vision in low light conditions and for detecting movement. PRA is inherited, which means it's passed down through generations in certain breeds. It's caused by specific genetic mutations that affect the normal functioning and maintenance of the retinal cells. PRA typically manifests in older dogs, causing a gradual decline in vision that eventually leads to blindness. However, the age of onset and the rate of progression can vary depending on the specific genetic mutation causing the condition. There are different forms of PRA, each associated with specific breeds and genetic mutations. Some breeds are more prone to certain types of PRA than others. This list includes just some of the breeds that are known to be potential carriers of the gene associated with PRA. Signs of PRA in dogs include night blindness. Dogs may have difficulty seeing in dim or low light conditions. Decreased vision. Over time, the field of vision narrows and diminishes. Pupillary dilation. The pupils may appear dilated more frequently, even in well-lit environments. Unfortunately, there is currently no cure for PRA. However, genetic testing is available for breeds known to be carriers of the gene, to identify carriers of the mutation. This can help in breeding programs to reduce the prevalence of PRA by avoiding mating between carrier animals. Breeds commonly affected are listed here. Regular checkups with a veterinarian, especially if you notice any changes in your dog's vision or behaviour, are crucial. This helps ensure proper monitoring and management of the condition to maintain your dog's quality of life as much as possible. Management typically revolves around adapting the dog's environment to accommodate their vision loss, maintaining routines, and avoiding significant changes in their surroundings. Cataracts in dogs are a common eye condition characterized by the clouding of the lens within the eye. The lens is normally transparent, allowing light to pass through and focus on the retina. When a cataract forms, the lens becomes cloudy and obstructs the passage of light, leading to blurred or impaired vision. Cataracts can occur in one or both eyes and can vary in size and density. They can develop slowly or rapidly, depending on the underlying cause. Some common causes and factors contributing to cataracts in dogs include aging. Just like in humans, aging is a primary cause of cataracts in dogs. Senile cataracts may develop as a dog gets older. Genetics. Some breeds are more predisposed to developing cataracts. Breeds like poodles, Boston terriers, cocker spaniels, and Siberian huskies are among those prone to hereditary cataracts. Diabetes. Dogs with diabetes are at a higher risk of developing cataracts, and diabetic cataracts can progress rapidly. Trauma. Injuries or trauma to the eye can cause cataracts to develop. The signs of cataracts in dogs includes cloudy or opaque appearance in the eye or both eyes. Changes in eye colour. In the affected eye might appear bluish or white. Decreased vision or blindness. changes in behaviour or difficulty navigating familiar spaces. Treatment for cataracts in dogs often involves surgical removal of the affected lens, particularly if the cataracts significantly impair vision and quality of life. However, not all dogs with cataracts are immediate candidates for surgery. Some cases might be managed with medications or supportive care to slow down the progression of cataracts or address underlying conditions. Regular vet checkups are essential for early detection and proper management of cataracts in dogs. If you suspect your dog is showing signs of vision impairment, consult a vet early for crucial and comprehensive eye examinations and appropriate treatment recommendations. The front part of the eye, between the cornea and the iris, is called the anterior chamber. Aqueous humor is a fluid produced by the eye that provides nutrients and maintains pressure. If this fluid stops draining properly, it begins to build up in the anterior chamber, which creates increased pressure within the eye, known as intraocular pressure, IOP. This elevated pressure can damage the optic nerve and other structures within the eye, leading to vision loss or even blindness if left untreated. This condition is called glaucoma and is serious and painful. There are two primary types of glaucoma in dogs. Primary glaucoma. This type is often hereditary and occurs without any underlying cause. Certain breeds such as Cocker Spaniels, Basset Hounds, Siberian Huskies and others are more predisposed to primary glaucoma. Secondary glaucoma. This type is typically a result of another eye condition or disease such as uveitis, inflammation within the eye, lens luxation, shifting or dislocation of the lens, trauma, tumours or ocular infections. Secondary glaucoma can affect any breed. Signs of glaucoma in dogs include redness in the whites of the eye, cloudiness or bluing of the cornea, pain, squinting, rubbing at the eye or pawing at the face, excessive tearing or discharge, dilated pupils that doesn't respond to light, vision loss. Veterinary diagnosis of glaucoma involves measuring the intraocular pressure using specialized instruments. Additionally, the vet may conduct a thorough eye examination to identify the underlying cause if it's secondary glaucoma. Treatment for glaucoma aims to reduce intraocular pressure and manage pain. This can include medications, eye drops or oral medications to lower the pressure within the eye. Surgery. Some cases may require surgical intervention to improve drainage of fluid from the eye or to address the underlying causes like lens luxation. Laser therapy. Laser procedures can sometimes be used to reduce intraocular pressure in specific cases. Unfortunately, glaucoma is a progressive condition, and while treatment can manage it, the goal is often to preserve the remaining vision and alleviate discomfort rather than fully restore sight. Regular monitoring and follow-ups with a vet are essential for managing glaucoma in dogs and preventing further vision loss or complications. Conjunctivitis in dogs, often referred to as pink eye, is an inflammation of the conjunctiva, the thin transparent tissue that covers the eye's surface and lines the inner eyelids. It's a common eye condition in dogs and can be caused by various factors including infections, allergies, irritants or underlying health issues. Signs and symptoms of conjunctivitis in dogs include redness in the whites of the eye, swelling or puffiness around the eye, watery or mucus discharge, squinting or blinking more frequently, rubbing or pawing at the affected eye, sensitivity to light. Causes of conjunctivitis in dogs can include bacterial or viral infections. Infections caused by bacteria or viruses such as canine distemper virus or canine adenovirus can lead to conjunctivitis. Allergies. Dogs can develop allergic reactions to various environmental factors, including pollen, dust, mold, or certain chemicals, leading to inflammation of the eyes. Irritants. Exposure to irritants such as smoke, dust, or chemicals can cause irritation and inflammation of the conjunctiva. Trauma. Injury or trauma to the eye can lead to conjunctivitis. Treatment for conjunctivitis in dogs depends on the underlying cause. Bacterial or viral infections include antibiotic or antiviral medications which may be prescribed by a vet to treat the infection. In allergies, identifying and avoiding the allergen when possible is key. Antihistamines or other medications may be used to alleviate symptoms. If irritants have caused it, flushing the eye with saline solution or prescribed eye drops to wash away the irritants could help. In trauma, treatment treatment may involve addressing the underlying injury or trauma and providing supportive care to the affected eye. Preventative measures such as keeping your dog's living environment clean, avoiding exposure to potential irritants, and regular grooming can help reduce the risk of conjunctivitis. If you notice any signs of eye irritation or inflammation in your dog, it's advisable to consult a vet for proper diagnosis and treatment. Prompt attention can help prevent complications and ensure your dog's eye health. Remember, if you do suspect conjunctivitis, it is zoonotic, which means they can pass it on to you if it's caused by bacterial or viral infection. So always wear gloves and refuse to groom until a vet has diagnosed the cause and offered treatment. Groomers play an essential role in maintaining a dog's ocular health, primarily by keeping the area around the eyes clean and free from irritants or debris. Groomers are not veterinary professionals and are prohibited from diagnosing or treating suspected eye conditions, but groomers can observe and report any abnormalities or concerns they notice around a dog's eyes to the owner or suggest a visit to the vet for further examination. Here are some ways groomers contribute to ocular health. Cleaning and grooming practices. Groomers often clean the area around a dog's eyes during grooming sessions. This includes wiping away tear stains, gently removing any crust or debris, and ensuring that the fur around the eyes is trimmed to prevent hair from irritating the eyes. Many groomers offer add-on services which can serve as a preventative measure, including using cleansers suitable for the facial area that remove dirt and debris from around the hair and skin surrounding the eyes, such as a blueberry facial. Recommending or using gentle and pet-safe eye wipes for routine cleaning or during a groom as well. Groomers interact closely with dogs and have the opportunity to notice any signs of eye irritation, excessive tearing, redness, swelling, or other abnormalities around the eyes. Keeping records on the dog's ocular health and prompting owners to seek veterinary attention if any abnormalities are observed. It's important to note that while groomers can assist in maintaining ocular hygiene, diagnosing eye conditions or providing treatment isn't within their scope of practice. If a groomer notices anything unusual or potentially problematic regarding a dog's eyes, they should encourage the owner to seek advice from a qualified vet for a proper diagnosis and treatment plan. Regular vet checkups are crucial for a comprehensive examination of a dog's eye health. Groomers can complement this by maintaining cleanliness and hygiene around the eyes as part of a dog's overall grooming routine.